It's Monday, it's October 16th, 2023. I'm in this monetary system within this flagged area. State, they say, is New York, within the United States of America, which is why I use this with this Federal Reserve note reminder. And um, just for placement in hyperspace or in on the cloud or whatever the people are, or the whatever and whatever. So I'm now going daily to this local um, supermarket job, and I'm working in the front end now through my studies at NCC, um, the medical microbiology lab. I have that level of, like, inside of New York, inside local Nassau County, matriculated credits. They use the Princeton textbooks. That's Ivy League. That's, I mean, reputable. Um, they use that's like textbook proper for education with ISBN numbers. So I used for methodology, and for reference, that's where my training was from. But without, like, I don't know, again, like, I just started the job. There's, like, I've had other corporate jobs, um, and corporate jobs like Chase had this very rigorous training. Like, it was uniformed. There was corporate trainers. There was a way, like, they taught you how to be a Chase representative, a JP Morgan Chase banking representative. If you were going to become a personal banker, how they wanted you to look, how it sounded, like what was the script you were to use if you were representing the brand. Um, in this new position, more locally, I do not, their corporate structure is not managed in the same way. There were a bunch of like remote computer simulations, um, but it was not as intense. There's not a lot of human interaction as far as it's a little more chaotic, let's put it that way. But again, this is not critique, it's just baseline for a more serious issue, which goes back to the NCC and the medical microbiology. So in this setting, um, they have not, there's pictures on the wall of what department heads and management looks like, but um, again, it's not real clear, like, when and who you bring stuff up to. And I'm just trying to make my way through it. Again, you're constantly on surveillance camera, so back office security, or however that's run, and surveillance, for corporate theft and loss and whatever, and however they use those video feeds, I'm not sure, in private security. So, but there's this, um, what's most astonishing is, which I get. I put on gloves today. I held out as much as I could, but my hands are starting to feel really rough from the amount of hand washing. Um, I don't want to get a staph infection or whatever. So Anyhow, so I'm putting on the gloves, and um, and all of a sudden, like, there's, I mean, I've worked in the medical micro lab, so there's this, there's several signs, even without having to swab and culture, whatever. Um, and I'll just give a specific example of today. Um, there was the type that almost felt like a feather, like just like being run across the skin, like, and you have to kind of wipe your face because it's like you just, you know, there's something there, you just can't see it. And then at another point, almost like, um it's something it feels like something peritrick is. There is a, almost like a dandelion, where a dandelion, like, is, the particle is so large that you actually could feel it, like almost like you inhale, like you're just breathing, and all of a sudden it feels like something just went in, or like near your nose. And you don't know, like, I mean, I looked around, I couldn't see what was floating in the air at the time that it happened, but all of a sudden I have to just touch my nose to try to get it away from the orifice. um so that happened. At other times it's like, the feeling almost of walking through a spider web. That's another way of describing that sensation of something that's so fine and not in the visual spectrum that the eye picks up on, but you know it's there and you know it's present. We just got through the pandemic, so I know whatever and whatever, 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 but there's not clear, um, like, to interpolate. There's not clear values established as far as chain of command, or where to report these things to. Um, and again, like with my background, being that it's like, I get somebody who's working as a cashier in a supermarket, might just feel like the brush against their face and not think much of it and just wipe it away. Surveillance would pick up on that as far as behavioral analysis, to know that it is present. But um, then having the lab training, and knowing that your eye is opened to that possibility and you're always vigilant, that's a whole nother level of awareness, for which I have. Um, so there's that. Then I noticed that in the local area, there's this new habit. Um, I think is just so strange, and I don't know how to handle it. With regular garden variety peppers, um, they take one green, one red, one yellow, and they're putting them in the same plastic bag. And of course, it throws me into a dilemma because the green has one sticker, the yellow has one sticker, the red has a different sticker, and now it's inventory differences. The amount of shipment into the store, having to put in the quantity. Um, I mean, again, heightened awareness because I've worked in management before, um, and at all different levels of employment. So, other jobs and roles, and not wanting to, whatever, knowing how they all, and like team management, having worked through the hierarchy of it, wanting to support managers' inventory and control loss, even by accidental, whatever. But so I'm trying to be swift in the time management of the customer, but also be cognizant of inventory. Um, but it is just such a bizarre thing that they take one plastic bag and shove all three peppers into one plastic bag. Um, and I'm noticing as like a societal population that that just happens to be a trend in the local area, um, which of course opens up a paradigm for me of a bunch of different issues going on for me simultaneously at different levels. There's that. Yesterday I had a man, which it seems so petty, but he was hiding the bags. Like he asked for four paper bags, and I'm like, right, four. And then when my back was turned doing the transaction, I guess he just kept taking more and more plastic bags, and he kept doubling them up. So technically, it would have been 16 bags, um, or it would have been 8 bags. But then there were more bags outside of my field of view that I couldn't see. And then after I had rang and I kept confirming with him, I'm like, so you're saying you only took 4 bags? Are you sure? Like, do you want to, like, and he's like, no, 4 bags, 4 bags, 4 bags. But it was more like 16 bags. So, I don't know why it just left me with such a, because I kept trying to confirm with him, and he just so blatantly took advantage of the situation. And I mean, this is somebody who's shopping in the local community, so I don't know. Um, so I'm having problems with that, but mostly what's concerning is the level of. And then and then I came home today, and I was so exhausted. I almost felt like I was coming down with something, so I had to close my eyes, and I took like a 2 hour nap, middle of the day. I'm only 45. There's no reason for it, but there's something going on. I just don't know what. Um, I also, when I went to the hospital the last time, they took an MRI, or no, they took a CAT scan, and there's something going on in my midriff. There's a lot of pressure being pushed out. There's something on my liver. Um, they have this hepatic word for it. They're brushing it off like fatty liver, and I'm just like, but I don't have. They didn't give me the images to examine. They only gave me the synopsis in words, so I can't even visually study it myself to get a better understanding, to document for my own behalf. I just have to go off of their word, which at this point, um, the year is 2023 at this point. Um, so there's a lot of pressure from inside my abdomen, and they picked up on two, um, an, an a, like umbilical hernia and then an inguinal hernia that are forming. And I have lately, I mean, I've my iron is fine, and then all of a sudden it suddenly drops drastically, and the hematologist had me go for an iron infusion. But again, these are random, I don't know what I was exposed to kind of attacks, and then try to correct it. Then my phosphorus went low. I was having a high amount of nitrogen at times, um, like a smell of ammonia almost. And it's not like a normal uric acid smell. It is like industrial cleaning ammonia, is what it smells like, which they say is like the breakdown of tissue and muscle and more proteins than usual, which again, but again, it's like I need a medical detective, and unfortunately, I don't even know where to find, like, where do you find a medical officer? Like, maybe they had the level of studies and, like, they have the ethics and whatever that the rest of the private practitioners don't have at this point. Um, I don't really know how they put together this health system with the doctors and the insurance companies. It makes no sense to me whatsoever. And it's not something that they've ever explained. Um, but what I am noticing is this almost like, I mean, I'm almost double the size that I normally am, but it's almost just like this. I feel like it's like this chemical reaction, whether it's part allergic, part whatever. But so now I have something put on the midriff in order to try to um, protect my abdominal wall from this pressure that's exerting outward. Um, and then towards the end of the shift, standing is incredibly, like, standing I can do. I can perform my main function, but on the lateral side, like my hip extenders and the lateral side between the quadriceps and the hamstring, um, shifting weight, I become very rigid in my lower extremities by the end of my shift. I don't know if it's something to do with relative to specific gravity. I don't know if it's a chemical exchange, like at an electrolyte or a metabolite level, with biochemistry being off. I don't know. I'm not sure what it is. But towards the end of the shift, by the time I walk out of the building, I don't look 45 when I walk. I look much more like some of the older crowd, like in their 70s to 80s, that are having trouble as well. Um, I'm only 45. It does not make sense whatsoever. And I don't know how to correct this by diet and by exercise. Um, there seems to be more in this. If I interpolate all of the possibilities at a graft, um, it just seems like more is going on. Um, and I'm having a hard time. I don't even know if like rectifying it at this point is the right thing to do. Um, I was watching Madam Secretary this morning, and they were mentioning Quaker State. And I'm like, right, well, that was kind of like, I suppose, the public school education that I went, a part of what I went to. Um, but I don't even really know because I don't know what the massive amounts of media portray Quaker as. So that gets confusing. All I know is that Lyndon Lou put me in the St. John's Red Cross and then took me home to Glen Way. So, growing up, that was all. It's star 1978, star 8378, Nicole, Cattaruzza, it's Earth, Solar System, Milky Way, Universe, Galaxies Broken, and it's Bayside Station, Bayside, New York, 11361.